Thank you, Tuan. So as he said, my name is Jessica. I am the admissions counselor at Midwestern University. We do have two campuses. I mostly represent the Arizona one. If you guys do have any questions about our Illinois, just let me know and I will put you in touch with one of their counselors and they can definitely answer more specific questions. But in general, we have two campuses, and on the Glendale campus in Arizona, these are our main colleges here. So we have our DO, pharmacy, dental medicine, optometry, vet med, and podiatry. So those are our main colleges. And then under the College of Health Science and Graduate Studies, we have additional degrees. Our campus is a healthcare profession. So every degree we have here is either a doctorate or a master's within a healthcare field. So that's actually nice for you guys. You will be networking quite a bit. When you guys start here, there are classes that integrate students from all programs so that you guys understand your role and how it affects other healthcare professionals and vice versa. And then our clinics, pretty much any program that we have on campus, we have a service for across the street at our clinic. Which is kind of nice. This clinic is a teaching institution, so service charges are typically cheaper than the private practices or hospitals around the area. So our community tends to really like that. They understand that they're being seen by students and being supervised by the correlated professional. And so that's why the services are a little bit less expensive, but it's very thorough. Just to give you an example, the top half of the map is our campus section. The bottom half of the map is where all the clinics are. So that's pretty much very close by. Students just walk across the street whenever they have to do their rotations. So it's very convenient for students, faculty, and patients. And then, as you guys know, we are in Glendale, Arizona. Here's just like a brief overview of where we are. So we're up at the northwest corner of the Phoenix general area. So we're just about 30 minutes from downtown, about 20 minutes from our football stadium. Some nice places nearby that students like to go to are Sedona, Flagstaff. So we're not just the desert, we still have some high country areas and some fun things to do nearby. So diving into the fun stuff, admissions requirements. In general, most of our programs do want a bachelor's degree from a regionally accredited school. A lot of students ask if they have to major anything specific like the sciences. For the most part, no. Most of our programs will accept your major in anything as long as you complete the prerequisites. The only exception to that rule is clinical psych and nursing. For clin psych, you do need a bachelor's in psychology and then some experience. And then with nursing, you do need to have your BSN degree and 1 year of critical care experience before you apply. But our other programs are a little more flexible and they are okay with a different major. Each program will have a minimum GPA that we are looking for, and then we always tell students to aim for our average stats as your minimum. That helps you get put into a competitive spot when we're being reviewed by the committee, and then how they compare you to other applicants. Same goes with the test score. There are minimums that you have to meet, but aiming for the average accepted test score is always the best. And then of course, completing your prerequisite work and then getting your letters of recommendation in. For the degree requirements, we briefly went over this a little earlier. There are a few that need specific degrees before entering, but for the most part, students enter with a variety of degrees and then complete their prereqs, and then you should be eligible to apply. This is just a brief overview of the prerequisites. So each college also has their own prerequisite courses that can be found on the website. And I will say our website is probably the best in terms of keeping up to date with prereqs, because if there's any changes or if they take away or add anything, the website is the first thing to get updated. In general, we need to have at least a C or better in all the prerequisites for them to count. A C- or below will not count. You'll have to retake it. And then for clin psych specifically, they need a B- or above to count towards the prerequisites. We accept AP credits, IB, CLEP credits, as long as you have the test score, or if it shows up on your transcripts, that can clear out prerequisites pretty easily. And there's no expiration dates on our prerequisites. So if you happen to have taken them about 10 years ago, we will still accept them. The only thing to keep in mind is sometimes the committee might want to see maybe some updated transcripts, and they may recommend that you take a few additional classes so they can see where you're sitting. But that's usually on a case-by-case basis. The other exception to that is occupational therapy. They do want anatomy specifically to be completed within 5 years. Patient care experience. So as you guys know, we are very patient care, healthcare centered here. So all of our programs are going to want to see that you shadowed, worked with a program, volunteered with a program, and they just want to make sure that you guys understand what that career field is about, some background on it, what the experience is like, that you've interviewed some of the healthcare professionals within the field that you're interested in. So that's what the patient care experience is for. No matter what area you go into, it's pretty large investment in terms of time and money. So that's why they want you guys to do all this prep work ahead of time. The ones that require specific healthcare hours is PT needing at least 30 hours, Vet Med needs at least 240 hours, and I mentioned before the Dean app requires 1 full year of critical care before you can apply. Everyone else just has a general recommendation to just get the experience, get enough knowledge under your belt. We won't be testing you on case studies or anything, but they will be asking in general what you kind of know about that profession. And then of course, PA specifically, with how competitive that program is in general, they need at least 1,000 healthcare hours that is paid. So for them, that's very specific. It has to be paid patient care hours. And those are some of the examples there that you could use towards that. So that's one thing to keep in mind if you're looking at PA. For the other ones, it could be paid, voluntary, shadowing, a mixture, and that's fine. Competitive applicants. So kind of like going over some of the things we had mentioned, getting those hours in, kind of going above and beyond your prerequisites with the sciences. Health certifications always help you out. So these are just to give you some idea of things that you could do outside of the academics to help boost your application. A lot of our programs are also looking to see that students have very good communication and professional skills. Sorry. And so with that, they do like to see that students can communicate well. They can maybe do like a leadership role, holding a student body administrative type role is sometimes helpful. So these are just some examples that you guys can use to boost your application. And this is our general application timeline. Most of our programs use a centralized application service, or we call it a CAS service. And in general, it takes about 2 to 3 weeks for the CAS service to verify your application before they give it to the school. Once we get it at the school, it takes us about 2 weeks to go through everything and decide on if we would like to invite you for interview. If the committee would like to invite you for interview, they'll send you an invitation and instructions on how to get that set up. And depending on the time of year you interview, it takes about 2 to 3 weeks for them to make their final decision. A lot of our programs, just because it's so large, they do have a meeting once a month, and they do kind of a batch review. So they'll interview students for the month of May, and at the end of May, they review that whole batch and get your decision. So that's why it's dependent on how long after you interview until you get your final decision. But in general, our applications are reviewed through different phases. The first phase is the academics. They want to make sure you meet the minimum. They kind of want to get a background on your academics, transfers, repeats, upward trends. That's what they're looking for. And then the test scores. The second phase of review is looking at your experience. They want to look at your healthcare hours, your volunteering, shadowing, either extracurriculars or anything you've done outside of the school. We also recommend that if you have anything that's even outside of healthcare, include it on your CV. Sometimes having that work experience, like maybe you worked at McDonald's part-time while you were in school, put that on there. A lot of our committees look for that type of work-life balance. And if you're able to juggle a lot of things, that also helps. We don't want you to do that. But if they see that and they're like, oh, wow, this person is very organized, they were able to handle a workload and work part-time and still fit in this volunteering, that does help boost the application a bit. So Don't think that there's any work experience that will be disregarded. Just stick it on the application, and you never know what they read from that. And then the next part of the review is the interview portion. So this is them getting to know you, wanting to make sure that, one, we fit your needs as a school, and then that you would fit our school in terms of being a future student. And then after the interview is the final review, where they make their decision on if they would like to accept or not. So it's quite a thorough process, which is why it takes a while. But just know you go through about 4 phases of review before you get your final decision. And then these other apps right here, these are in-house apps. So we get through these a little bit quicker than the ones that go through the CAS service. But same process, we still look at your academics, then we go straight into your experiences, personal statements, letters of rec, and then we go into the interview phase, and then they make their final decision afterwards. So now we're going to do a quick touch on the various programs that we have on campus. Our biggest one is our Arizona College of Osteopathic Medicine. It's a class of 250. And so with this one, this is our medical school. A lot of students kind of always want to know what our match rate is, and we have a 98% match rate. And although we do have a lot of students who kind of go into this with a primary care mindset, if you are interested in any surgery subspecialties, we've had more interest in those, and the students who have asked for those residencies so far have been able to match. So that's the one thing to keep in mind. With the DO and the MD differences, the main thing would be more of the mindset, and that the DO has a osteopathic manipulative medicine component. So this is where they're more looking at, it's a different approach to looking at the body in healthcare, but they kind of focus on having your body kind of help heal itself through different techniques. And that they'll show you that when you guys come to interview, they'll give you a demo. But otherwise, we have created our curriculum to be pretty similar to the MD curriculum because of the merger. The residencies for DO and MD have now merged. So we have adjusted our curriculum to make sure that you guys are just as successful as MD students when going into residency. You just have an extra component that helps you with the healthcare part. But for the most part, your curriculum for MD and DO are now pretty much lined up really well. So you're competitive in both medicine aspect for allopathic and for osteopathic medicine. Our program is very similar to MD's. It's 4 years. It's 2 years of didactics, 2 years of rotation, and we go on a quarter system. So all our programs are by 10 weeks per quarter with a 1 to 2 week break in between. And with that, you will be doing most of your, as I mentioned, most of your coursework will be done with the podiatric students. You're going to see that a lot. A lot of our programs will link up and do courses together. And so that's where you get your interprofessional experiences from. But yeah, so that's for our osteopathic medicine. And then we have our College of Pharmacy. This is a doctorate program. It's 3 years. It is accelerated. I believe most programs are 4 years. And then we have 1 year of, 2 years of lecture and 1 year of rotation. And they begin in June. The only programs we have that begin in the summer are pharmacy, the PA program, and our OT program. All other programs start in August. And our pharmacy program, it has we max out at a class of 100. And these are the average stats that you're going to want to aim for to be competitive when applying. And then our College of Dental Medicine, doctorate degree, 4 years, 2 years of rotation, 2 years of lectures. And for dental medicine specifically, they are looking for good teamwork capabilities because they pair you off with an upperclassman right when you start, and you guys stay linked together throughout all 4 years. And you also will be doing rotations here on campus across the street. So with them, the teamwork component is very important. They have a class size of 144. They max out at 170, and their average, I would say for them specifically, they do focus on the DAT. So if you're taking the DAT, do aim for at least a 19 across all sections. And then you can see there, that's their average for their science GPA and the overall GPA. And this is the College of Podiatric Medicine. It's a doctorate as well. They follow a very similar structure as our DO students. 2 years of lecture, 2 years of rotation. The 2 years of lecture are done with the DO students because the curriculum is very similar. And then they branch off when they do their DO and podiatric medicine specific courses. Rotations will sometimes overlap depending on the hospitals that take our students. If they have multiple specialties, you're going to see a lot of other students from Midwestern on rotation as well, which is nice. You see your colleagues. They have a smaller class of 35 max, and then their average MCAT is a 499. That's one thing for them as well. They do have a little bit more weight on the MCAT, just like the DO school does. So you'll want to at least aim for that 499 or above to be competitive. Then we have our College of Veterinary Medicine. It's a doctorate and it's 4 years, 2 years lecture, 2 years rotation. Also in a quarter system with a class size of 134. They actually no longer require the GRE, which is nice, but that does mean that they put more weight on your science GPA. So you are going to want to aim for that 3.53 or as close to it as possible. A lot of our programs also do look for upward trends. So if for some reason the GPA is a little lower, but the last 2 years have a very strong upward trend in science courses, that can help sometimes offset the lower GPA. Our PA program it used to be 3 years. We are now at 24 months, so just 2 years. It is a master's program. They begin in June, and they will be more of a fast-paced one. So it's 1 year of lecture, 1 year of rotation. They only have 90 students in their class, and with them, they are very competitive. So you do want to kind of use their average GPA as a minimum and aim for that 3.6 or above. They also no longer require the Casper test or the GRE. Those were 2 requirements in the past and possibly required by other programs, but ours no longer require those 2 tests. So they do weigh your GPA a little bit heavier, and they want at least the minimum 1,000 paid patient care hours. And then our other is a doctorate of physical therapy. That is now a 3-year program, and it also goes by very quick. They are going to start in June as of this year. So they are switching or transitioning from the fall to the June and kind of lining up with our OT program. But they also no longer require the GRE. They're going to look at the science, and the overall GPA is a little bit closer. So those will be the numbers you kind of want to aim for. And then occupational therapy, kind of very similar to the PT in that they also start in June now that they're lined up. Theirs is a little shorter. They're only 24 months, and they have a smaller class of 32 and also no longer require the GRE. So they're looking at overall GPA of a 3.4 is what you'll want to aim for. And then our cardiovascular or perfusion program, this is a master's program. It's 21 months. They have a class of 44 students, and with them, they do put a little bit more weight on the GRE. So you do at least want to aim for about a 45% minimum, but you can see that their average GRE is 52%. But so you're going to want to put a little bit more emphasis on your GRE, make sure you study well for it, and then have that linked up with your strong GPA, and that puts you in a good spot. With this program in particular, we're very aware that it's hard to find shadowing or kind of volunteering hours within the perfusion profession. So if you're having troubles, go ahead and contact us. We have our liaison who is really good at helping you guys link up with someone to help get that shadowing experience. And for that reason, they also don't require a large amount of numbers. They kind of at least want one interaction with a perfusionist. So if you do have troubles finding a perfusionist to talk to interview with, or to shadow, call us, let us know. Our liaison will kind of help you get in touch with somebody. Then we have our doctorate of nurse anesthesia. This is a newer addition. It used to be our master's, and we're now switching over to a doctorate. It's a 3-year program, and it is a combination. So you do have a portion that's online and on campus. And that's because they do expect most of these students are working full-time as nurses, which is why we have the online portion. Then when we bring you to campus, we'll do all of the lectures at that time. And then in year 3, we help you get rotations, or we help assign rotations for you. So you're not left to find them on your own. We have them available, and then you can kind of sort out your schedule that way. But it's 3 years, smaller class size of 38, and that's the average GPAs that you'll want to aim for to be competitive. And then we have our Clin Psych. This is a PsyD doctorate program. It's 4 years. We do have the option of doing a neurotrack. So if someone is interested in that, it's kind of like a little fellowship where they give you that extra experience. So that'll take 5 years. But in general, it's a 4-year program. Very similar to the others where you have 2 years of lecture, 2 years of rotation. This is a smaller class they have 30 maximum, and they had 29 students last year. No longer require the GRE. And then they, similar to perfusion, understand that it's hard to get experience or shadowing with a psychologist. So if that's the case, give us a call. We can definitely put you in touch with someone or help you get some shadowing or volunteering under your belt so that you have some awareness of how those kind of clinical therapy sessions go. And then we have our speech language pathology. It's a master's program, 21 months, class size of 51, no GRE for them. And they look at your overall GPA. So they're looking for about a 3.47. They don't put emphasis on the sciences. So you just want to make sure in general you have about that, aim for that GPA. And then we have our biomedical sciences. We have 2 of these programs. They're both masters. For the Masters of Arts, it is a 9-month program. It's very quick. This one specifically is meant to help feed students from the master's into one of our other doctorate programs. Oftentimes, we look at these as kind of the second chance program. So if a student is very able and capable of getting through this program, our doctorate programs here will look at their master's GPA, and that can help offset any undergrad hiccups that you guys might have had. So maybe you entered in with closer to a 2.8 or a 3.0, but you know you can get through the program. And if you do this master's program and you get a 3.2 or above and meet the program's minimum testing standard, you are automatically guaranteed an interview. It obviously doesn't guarantee a seat because you still have to interview, but if your interview goes well and you meet their stats, the agreement between biomed and those doctorate programs will hold. So that's what the 9-month program is typically used for. And then for students going into the 2-year program, the MBS, you can either use it to get into one of the other doctorate programs, or some students use this as a standalone to get a biomedical science research job or to teach. So the 2-year program is more as if you're wanting to do this as a career. And then the 9-month program is specifically a feeder type program. So just know that there's 2 options. Both of them have agreements with the other doctorate programs on campus that help you kind of get the foot in the door, get to know the faculty here, and then kind of helps you guarantee that interview as long as you meet their specific stats, their specific minimum stats per program. And it's pretty popular with our dental, our DO program, and pharmacy. I think DO took about 80 students from them last year. So they're really good students. We like that they know the school. We like that we can see their dedication. So if you choose this route, just know you have really good support in helping you get to your final goal. And this was just the articulation agreement I discussed before. Being in good standing, meeting that 3.0 GPA, and meeting their minimum testing standards gives you the chance to interview. And if you do well, then obviously we like to grant you an acceptance. And this is just to brush up on some of our other nursing programs. These are a little bit newer. So we do have a Master's of Nursing with 2 different options, one in adult gerontology, one in nurse leadership. These are usually for applicants who kind of want to continue their education or advance their bachelor's. And these are our hybrid ones where we do it online and in person as well. And same with this one, very similar, but this one is the Doctorate of Nursing Practice. So similar to the Doctorate of Nurse Anesthesia, this is that combination of online and on campus. And very similar to the master's, you cover the same type of topics, just a little bit more in depth, because some students come in with the MSN and want to continue to the doctorate and maybe hold a more administrative role, a leadership role. This is what that's good for. There are a few dual degree options. So we have our Master's of Public Health, Master's in Science Precision Medicine, and then our post-grad certificate in precision. So right now, there aren't many standalone ones. We have these paired with other doctorate programs on campus. And so you can see it listed here that DO, dental, optometry, and vet med are the current options that offer these dual degree options. If it goes well, some of our other doctorate programs may want to pick it up and be able to fit it into the curriculum. These programs do not extend your doctorate program by any means. They're meant to supplement. They have a hybrid option, so you most of the time will be doing these courses online during rotation time, during your summers. So that's kind of how they fit it in without extending your time to like 4 or 5 years to add in the dual degree. But there are just some nice options. If you have more specific questions on it, we can definitely help answer them, but that's just a quick overview of what's offered. And then here are just some of the reasons why students have chosen Midwestern. We have a very open door policy with our faculty, so they're very much here to help you guys and very friendly. So when you guys come, you'll kind of get a feel for that. And it's one thing that they do pride themselves on, because if students are ever struggling, whether it's academics or even personal, you can come to them and they will help you. Once you're here, we don't want you to fail out. We want you to pass. So they'll do whatever it takes to kind of get you where you need to be. And then, of course, being interdisciplinary, you'll be interacting with a variety of other healthcare professionals, building your network, understanding the healthcare system, and you're pretty much very well prepared once you hit rotations because of all that background knowledge. And then all our programs have a very high board pass rate. We're always well above the national averages. So that's kind of nice to know as well. And then, of course, our reputation has been holding pretty strong. And then these are just some tips for interviews. We always want to make sure that students come professional, they come on time. Sometimes with virtual, I think students may forget the time zone, so just make sure you check your time zones. Another thing that I do want to suggest is interview prep or mock interviews. Go to whoever you've been shadowing with or working with and ask them to run through a mock interview before the day. That just helps you, one, get your story lined up. It helps you organize your thoughts, making sure that you have everything sort of under your belt in terms of like being prepared to answer questions about the profession, what you know about the profession, and what kind of drives you for this profession. Typically, that's what our interviews are looking for. They're looking for teamwork, communication skills, professionalism. That's what they want to see. So we already know it's kind of a nerve-wracking day in general, but mock interviews, I think, help our students the most, is what I've heard from their feedback afterwards, is that they worked with someone, they got comfortable with answering questions in that manner, and it helped. And then a big thing recently is no-shows. If you can't make it, please notify us. We want to be able to offer that seat to someone else for interview, or make sure they get the opportunity to interview. No showing definitely puts a little bit of a flag on the application, because that comes part of the professionalism. So that's one thing to keep in mind, that no matter what school you're interviewing with, just let them know ahead of time and make sure you're communicating with them on whether or not you would still like to attend, or if you can't make it, then just let them know ahead of time so they can take you off and they don't mark you as a no-show. So these are just some final tips of just make sure you maintain your GPAs. If you are a little bit lower on the GPA, that's okay. Just do an upward trend, look at options on how to boost it, things like that. So make sure you're seeking guidance on how to get that up. And then just making sure you stay in touch with your advisors and then your the people who you shadow. Those are usually the people who end up writing your letters of recommendation, and we do take their feedback into account because they typically know you the best. And that often does help students sometimes, if they can see that someone within that profession is speaking so highly of you and saying that, yes, you'd make a great doctor, or you shadowed with them and they saw all these qualities that may not be seen in the written part of the application, but is shown through the letter because it was someone who knows you. So just make sure you get good contact with them. But those are just some other tips there that you can kind of read through and just kind of brush up before applying. And we definitely do encourage reapplication. So we give feedback if you are not accepted. If you are wanting to reapply, give us a call. We'll give you the feedback. The committee is always great about letting students know what can be done to help improve their standing, which I think is very beneficial, because when you guys reapply, we look at your previous application to see if you've taken some of those into consideration. So if we see the improvements, that actually does help you. I know some schools don't always look at reapplicants very positively, or they might show and just kind of take them off the list. Just know that for our school, we don't approach it that way. We do look at reapplicants, and we kind of look at where your progress has been made. So that's what they're looking for in terms of when your application comes through again. And then this is just our contact information. So if you guys want to do a quick snapshot of it, I'll leave it up there for a few seconds, and then I will close out to, I'll stop sharing to answer some questions. All right. Oh, I see we have some in the chat.
Yeah, and actually I could give you those questions again right here. I'll put it into the chat for you, the questions that we have.
Perfect.
Right. So here are the two of the questions. Copy, and then I'll go everyone. First question is, how do you basically view repeats?
For us, yes, for most of our programs, the repeats are fine. Just know that the CAS system will be averaging your GPA. So they're going to take into account what you had before and your current grade and average those out. They don't calculate GPA with the replacements in there. But when we look at it as the committee, we do see like, okay, they didn't do well maybe this semester. But if we see that down the line you retook it and you did really well afterwards, we do take that into account, and it's not counted against the student.
There's another question on your biomedical science MA program. And specifically, is that a good option for a student wanting to improve their GPA for example, for medical school?
Yes, this is a very good option. So a lot of students who are just a little bit under that preferred GPA for med school will take this biomed route. And oftentimes they do really well in our biomed program. And you're here on campus, which means you get to also connect with the current ASCOM faculty. And when you connect with them, a lot of times they will be the ones vouching for you in admission, saying like, hey, so-and-so is in biomed, please take a look at them. They've been doing really well in my class, or like they've been shadowing me because they're here on campus. So yes, if students are very interested in that biomed route, it gives you a good glimpse of what that first year of med school is going to feel like. And doing well in that program shows the committee how well you've been able to boost your study skills and handle a heavier workload. And oftentimes they will put the undergrad GPA aside and just look at your master's. So that often helps if students are wanting to boost that undergrad GPA.
Looks like there's a new question on if a student received their PhD in medical science from overseas, can they apply for your PA program?
You can. You will just have to get the transcripts from overseas converted over to US. That's usually done through the WES or the ECE website. So those are the two transcript evaluation systems that we use. And what'll happen is they will do a course by course evaluation of the transcript. And us at the school, we're looking forward to make sure that it converts over to at least a bachelor's US degree. And we're looking at the courses to see what we can take towards the prerequisites. If for some reason those courses can't be taken towards the prerequisites, then we'll recommend that you take the remaining courses through like a community college here to kind of get that cleared up and get caught up.
And I do see that there's another question on, should students retake any science courses with C grades?
It kind of depends on the program. Most of our programs would like to see a retake if there is time, But if it's kind of a time crunch and you kind of need to focus either maybe on your MCATs or your entrance exams, we prefer to see the improvement happen in the entrance exam. But if it's someone where like maybe they took it in their freshman year and they have time to retake it for a better grade, then yes, we would recommend that.
Looks like we're doing pretty well on time. We do have time for a few more questions. So if anyone has a question, feel free to either unmute yourself to ask the question or put it into the chat. Actually, I actually do have a question. Oh, actually, not Leticia. Do you have a question?
Yeah, I'm going back to the biomedical program. I don't know if you guys have numbers or know, like the students who major in biomed, is it because they're not sure if they want to go into nursing or go to medical school, become a doctor, and does your school have numbers like where they end up, landing jobs or what they end up doing after?
We don't always have numbers because they kind of go off to a variety of different areas. I will say for students who they got where they wanted to go, if that makes sense. Like if they wanted to go straight into dental, they were able to get there. If they wanted to go into a research job, they were able to get it. We haven't had feedback in terms of students going through the program, passing the program, and not being able to get anything. But yes, with biomed, because it's so versatile, students often will be applying kind of all over the place to various professions. But for ours in particular, most of them take it. I think the majority of our biomed students either go the dental route or the DO route, tends to be the heavier interest. But yes, that does kind of change. It depends on what the students are looking for. But to date, we haven't had any students who could not find anything related to what they were intending to do with biomed.
Sylvia, do you have a question, Sylvia?
Yes. Hi, Jessica. It's Sylvia from Mesa Community College.
Yeah.
I have a question. So I advise students at the community college level. And I have a lot of students that they already have a bachelor's. They're coming back and they're trying to do the prereqs to get into a medical school. Of course, we only offer the lower division, and that seems to be what's available. Should I be telling students then to, to take genetics and biochemistry and some of the 300 level courses, or can they just do the regular 100 and 200 level biology, chemistry, stuff like that? Or do they need those 300 level courses to be accepted into medical school?
For med school specifically, you'll want to aim for the higher levels in terms of anything beyond general bio, general chem. With those, if you don't have them, we have recommended students doing them online, and that's okay. We've taken them from like University of New England, or sometimes there are extension courses through like a university like San Diego and UC Berkeley extensions are what we see pretty often. But yes, we recommend that if they are trying to boost their GPA, having the upper division courses really helps showcase the committee, like they can handle a heavy workload, they can handle the faster paced courses. But if they're just trying to clear out prerequisites, then doing them at the community college is fine. It's more of if they're trying to advance their science GPA is where we suggest upper division sciences.
Jessica, actually, I have a question for you because this one I kind of know the answer, but maybe to help everyone else out too. When you review GPAs, how do you kind of break down the GPA? Overall GPA in your math and science, trends in GPA, last 60 units, especially for some of your more popular programs, especially let's say the DO program or the vet one.
Yes, so we actually break them down pretty much down to like the nitty gritty. So what'll happen is the CAS system will send us the overall GPA. And so we'll see a science GPA and then a total GPA. Science GPA encompasses general or chemistry, bio, and physics courses. and then total obviously takes into account everything. And then we also break it down to GPA per year. So the freshman, sophomore, junior, senior year GPAs. And then we break it also down to any post-bac or graduate courses that students have taken. And then we also look at the last 60 units. So those GPAs as well. So that's what they're looking at when they're doing the GPA or the academic review, is they're going to look at each area. So that's why we say, like, if for some reason you had a little bit of a hiccup, maybe in like that freshman, sophomore year, the committee will see it and they'll see that you've been trying. In the last 2 years, you're like straight A's and B's. That shows a pretty strong upward trend. And oftentimes that paired with a good MCAT or paired with really good experiences can help get that student the interview.
Right.
Any other questions? And is everyone here mostly for medical school information? So I think tomorrow we have a optometry info session too with my other colleague, Becca.
Yeah. I think a good portion are medical school, but I think that, for the advertisement of this workshop, we did advertise it as a potpourri of all your programs at Midwestern. Lorena, do you have a question, Lorena?
Yes, hi. I also work at a community college, and I also work with ESL students, or a lot of students coming in from other countries that are professionals in their country, and some are, doctors or studied, have those degrees in their countries, and they're trying to, or they ask, can I become a doctor here? And I always, what's the best answer for that when they already are professional MDs or pharmacists, et cetera, in their country, and they're trying to see if they can become one of our pharmacists or doctors? What is the best approach in that situation?
Yeah, unfortunately, a lot of the US schools won't take those foreign credits as like transfer credits, so they won't get advanced standing, and oftentimes we'll have to start in year one in whichever profession they're looking at. Once in a while, I have seen, and this is very much residency based, but some medical residencies will allow a foreign student to take the USMLE or the COMLEX, which is the board exams. And if they pass it and they get into that residency program and finish the program, then they can practice as a physician. But that is a bit rare, and they would probably have to do a bit more research on it and call around. But in terms of med schools typically will not take the foreign transfers and give them advanced standing. So they kind of have to come in with the mindset like, hey, I'm going to start from year one. I'm open to learning. And, they maybe could offer some of their experiences from the international program or international experiences towards the current med program. And that's perfectly fine. And often our med schools like that. But you do at least want to advise them, one, making sure they kind of call around to different residencies to check on if that residency will accept their visa status. So that's the big thing. Our school will accept international students, no problem. It's just the residency programs that kind of can be a hiccup. If they don't accept foreign students, then it makes it really hard to match, which means it's hard for them to practice medicine afterwards. So that's kind of the first thing they want to look at is, all right, are there enough residencies out there that take international students or international visas? If the answer is yes, then apply to our school or apply to like med schools, and they can kind of come through. We also view them the same as any other student. Since we're private, we don't have a preference on international, in-state, or out-of-state. They're all kind of coming in with the same set of standards that we hold them to. But yeah, I know international is a little bit of a trickier one.
Yeah, I know. Thank you. Thank you for the answer.
Not impossible, just a little more research.
So you would say that private universities would have, I don't know, I don't want to say the wrong thing, but could potentially, there may be more opportunity there than a public institution for students in this situation?
Possibly, yes. Just because we have, I feel like private has a little bit more flexibility in terms of the applicants that we can take. We're not held to a quota. We're not held to like, I know that some state schools have like funding that they have to kind of meet standards for, and maybe there's not enough international student spots. But for us, those factors don't always play into our acceptance process.
Thank you.
Okay. It looks like we have about 3 more minutes for the session. So if there's any final question, please feel free to ask it. If not, then we will just do a few closing comments.
Yeah, I do want to give a bit of advice, because I know we have advisors on here. So I will say, when you're talking with your students that you're advising, we always recommend kind of touching on communication skills and professionalism skills. Those are sort of two things that can hurt a student during the interview process. So we want to make sure it's not a prerequisite, but at least if students can kind of maybe get some mock interviews, or if they have some work experience that gives them that professional interaction, that can kind of be taken in, because we know some students are coming straight from either high school or undergrad and applying, so maybe they didn't get the chance to develop some of those. But that's one thing that we're kind of seeing during our interview sessions that may or may not hurt the applicants when they're talking with the faculty members or talking with our current students, is just want to make sure you have some of those skills under your belt. And then, of course, experience. A lot of them, I think, don't realize that if you didn't shadow and you don't understand what it takes to get yourself through the kind of ups and downs of med school, or actually any doctorate program, very much highs and lows throughout. But we want to make sure students understand that, so that when you guys come here, one, you know who your resources are, you know how to get through the lows, and we definitely help you get through the lows as well. But we want to make sure that students kind of just don't default and sort of burn out because it got a little bit too stressful during a part of the schooling or part of the curriculum.